Assalamualaikum. My name is Madam Norliza Hussin and my partner is Encik Muhammad Iqbal binti Nasaruddin. The topic today is oral care for patients with endotracheal tube among nurses intensive care unit in Hospital University Science Malaysia. This is outline presentations. First, introduction. Second, objective. Third, methodology. Fourth, result analysis. Fifth, conclusion and recommendation. And thus is reference. Introductions of the topic. Oral care for patients with endotracheal tube reduce the amount of bacterial growth in the cavity by mechanical pharmacology interventions. Oral care procedure is one of the precaution measures in preventing ventilator-associated pneumonia, or we call VAP. VAP is one of the most common nosocomial infections that infects patients admitted to ICU. This study will provide enlightenment on how critical nurses perform on oral care practice in their service and act as a reference in creating a new or update guideline in maintaining patient oral hygiene. The purpose of this study is explore critical nurses' practice of 10 educational and professional attitudes related to providing oral care to patients with endotracheal tube. Methodology for this study: research design, a cross-sectional study design, and is a quantitative study. Setting in Hospital University Science Malaysia, Kubang Krian, Kelantan. Population registered nurses working in critical care area in Hospital University Science Malaysia. Sampling plan inclusion criteria is all registered nurse working in critical care. Exclusion criteria: nurses not working in critical area. Sampling method: persuasive sampling method. Sample size 32 responded. Instrument self-administered questionnaire. There is include 4 parts. Part A, demographic data. Part B, knowledge of oral care for intubation patient. Part C, attitude about oral care for intubation. Part D, practices of oral care for intubate patient. Data analysis statistic will be analyzed with SPSS software version 22. This is our result. Table 1, demographic characteristic of patients. Result table 2, ICU nurses sources of learning about oral care for patients with endotracheal tube. This is related knowledge and on oral care. Result table 3, level of attitude, importance of oral care in physical care activity and nursing treatment as perceived by the nurses. Result for table 4, nurses' ideal performance frequency for oral care practices for patients with endotracheal tube. Result and analysis continue. Participant characteristic as shown in the table 1. The level of nursing education that showed the highest frequency was a diploma in nursing at 81.3%. This indicates that nurses' majority are diploma qualifications as nurses in Hospital University Science Malaysia. Level of knowledge, as shown in the table 2, in the service education at ICU was highest 84.4%. Different sources of learning about oral care can affect nurses' performance in terms of their frequency of oral care practice and oral care knowledge. The result also revealed that had in service education at ICU a positive impact on nurses' knowledge regarding oral care for intubated patients. Result and analysis. For table 3, level of attitude, importance of oral care in physical care activities and nursing treatment as perceived by the nurses towards an importance of oral care elicited responses that it was important and very important from 46.25% and 46.50% of the subjects, respectively, indicating that they felt the importance of oral care was high. Table 4, importance of oral care in physical care activities and nursing treatment as perceived by nurses, 96.9% are performing oral care with a cotton swab or foam swab every 6 until 8 hours or more often. This result study provides enlightenment on how critical care nurses perform on oral care practice in their service and act as a reference on maintaining patient oral hygiene. Conclusions and recommendations. This study showed that Hospital University Science Malaysia nurses had different source of the need about oral care. Therefore, they had a positive attitude towards the practice of oral care. Thus, creating more competent nurses, it should be noted that information and knowledge keep getting updated. The nursing curriculum needs to update procedure oral care for patients with endotracheal tube patient while encourage nurses to obtain more accurate knowledge regarding oral care. Thank you and terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.